Hello everyone, and welcome to today's Heart and Stroke webinar. My name is Pam Fonseca, and I'm the Director of Health Systems and Policy in Nova Scotia with Heart and Stroke. I'll be your moderator for today. Unfortunately, our other moderator, Kyle, was having some technical difficulties and won't be able to join us. I want to start by acknowledging the land on which I sit here today in Halifax. It's the traditional, unceded lands of the Mi'kmaq people. We're gathered today because of our shared commitment to equity and health equity in particular. So I encourage you to reflect on what this means for you and your work and your lives from coast to coast to coast, or wherever you may find yourself as you listen to our speakers today. When you join today's webinar, you'll be joined in computer audio. If you prefer to listen via your telephone, simply select the phone call and dial-in numbers will auto-populate. If you need to expand or contract your control panel, simply select the orange arrow button in the top left corner. Questions are welcome during today's webinar, and you can enter them via the question panel. Please enter them at any time during the presentation, and they'll be addressed during the question and answer period at the end of the webinar. This webinar is being recorded and will be available for viewing, and you can access the webinar after the event on the Heart and Stroke YouTube channel and the Stroke Best Practices website. Today, after the webinar, all attendees will be emailed invitations to complete an evaluation, which will then lead to certificates of participation. Heart and Stroke employees across the country have been working rapidly to bring you reliable and credible information as we navigate these times. If you haven't already done so, you can find us on YouTube and follow us on Twitter at HSF_science and at Heart and Stroke, where we are constantly updating our resources and emerging information as it relates to heart, stroke, and vascular cognitive impairment. If you'd like to live tweet throughout the presentation today, please join the conversation by tagging us with our Twitter handle on screen and using the hashtag HSFScience. In addition to webinars, we're also bringing you information in different ways that best suit you. So as noted, be sure to check out our website at heartandstroke.ca and some of our other platforms on ways to connect. Mark your calendars because on December 2nd, Heart and Stroke and the Canadian Partnership for Stroke Recovery will be hosting a joint webinar focused on virtual care and rehabilitation. This webinar will bring together a panel of experts to discuss different aspects on virtual rehab care, and the registration for the link will be sent out shortly, so watch for the update within your inbox. So back to this webinar. As many of you are aware, Heart and Stroke leads the Canadian Stroke Best Practice Guidelines, and we're just finishing the prevention module update right now. In this updated module, air quality has been added as a risk factor for stroke and heart disease for the first time, and evidence continues to emerge on outdoor air quality and CVD. And we're seeing air quality appear on many different risk factor lists now. Once released, you will be able to find this updated module on the Canadian Stroke Best Practice website, listed here in the right-hand corner of this slide. We wanted to share this information through this webinar with our partners from Health Canada who are doing a lot of work in this space. Today, we're going to hear about indoor air quality and tips to help you stay active through the colder months. And so now, we'll just give a quick overview of the webinar. So this webinar will provide a brief overview of the relationship between air quality and heart and brain health based on our current evidence and experience. And as the weather changes, the impact of COVID-19 increasing the amount of time people spend indoors, we'll then hear some practical tips to incorporate into your daily routine to help stay active during these colder months. So today, the key topics our panelists will address include discussion of air quality as a risk factor for people with heart conditions, stroke, and vascular cognitive impairment, while exploring some of the supporting evidence. Practical tips and available resources will be shared as ways to mitigate the negative impacts of indoor air pollution on one's health and on the health of patients and their families. Practical tips and strategies for staying active through the colder months. And again, at the end of the webinar, we invite all attendees to inquire further and receive answers from our experts. So don't forget to submit your questions via the chat box throughout the presentation. So I'm pleased to welcome today two speakers who are respectively experts in their air quality and cardiac rehab. So I'll briefly introduce them as we go. Our first speaker is Patrick Goegan, and Patrick works at Health Canada and is an air quality research and expert based in Ottawa, Ontario. Over to you, Patrick.
Thanks. Thank you. Hello, everyone. My name is Pat Goegan, and I work for the Indoor Air Contaminants Assessment Section at Health Canada. I'm a member of a team of scientists and researchers who work to understand the health effects of air pollution and what steps that we, not only as the government, but as individual Canadians, can take to improve the air in our homes. As part of the federal government, our team studies indoor air pollution and are always looking for ways to improve the quality of the air indoors. As part of the work we do, we look for opportunities to speak to the Canadian public, whether at trade shows and conferences, directly through emails and phone calls, via social media, or make presentations. And so we appreciate the opportunity to be able to present to you today. Today's presentation will be in English, but we can make the slides available in French to anyone who requests them. And if any questions that are submitted today are in French, one of my colleagues will follow up in the coming days. I'm a biologist who works for the Indoor Air section at Health Canada, and as a government employee, we do not have any conflicts with respect to our funding, and we do not have any potential for conflicts of interest with any other organizations. So I'm hoping that the information I'll be presenting today will provide you with the understanding of the types of pollutants that can be found indoors, the risks of being exposed to these pollutants on your health, and what you can do to improve the air quality in your home. Having had many years of experience meeting and talking with Canadians about indoor air related issues, we've discovered that the average Canadian homeowner thinks that protecting their indoor air is complicated, and people express a fear that there may be pollutants in their air which they cannot identify, which may be having an impact on their health. After today, I'm hoping that you'll leave with a good understanding of indoor air pollution and what steps you can take to protect yourself and your family. So the plan for my presentation today is to introduce you to the following information. Why should we think about indoor air quality? What are the pollutants of concern? Where do they come from? Who's at risk? What are the health risks? And what can we do? So next slide. Now, when I think about Canada, I picture mountains and streams and rolling pastures and breezes blowing in from the coasts. Primarily, I think about the great outdoors when I think about living in Canada. But the truth is that we Canadians spend around 90% of our time indoors. We live, and many of us now work at home, or we work in buildings. Our kids go to school in buildings, we shop in buildings, and we congregate for activities in buildings like gyms, restaurants, and coffee shops. Considering that we spend the majority of our time indoors, it's important that we pay attention to the air we breathe while spending our time in these different indoor spaces. Now, the indoor environment can contain hundreds of different air pollutants, some that infiltrate from outside, but with the majority of them being generated by sources within the home. And unless methods are adopted to address the air pollution you find inside, some of these contaminants may be found at levels higher than outside. And since we've studied these pollutants, we know that they have the potential to cause health effects, especially in people who are susceptible. So what are the sources that contribute to poor indoor air quality? Different pollutants can be derived from different sources, and some pollutants can arise from multiple sources. On this side, I'll outline the sources of indoor air pollutants, but will provide more specific detail on the individual pollutants on the following slide. Combustion-related activities involve the burning of fuel or other organic material which can produce pollutants like particulate matter, which are small particles that become airborne and can be inhaled, as well as carbon monoxide, nitrogen dioxide, and volatile organic compounds, all which have the potential to cause health effects. Activities such as smoking and heating your home with combustion appliances that are not properly vented can produce pollutants in the home. Cooking activities such as frying can produce particulate material, as well as nitrogen dioxide if your home is a natural gas stove, which is not properly vented by using the range hood fan above the stove. Combustion materials can also infiltrate into your home from your attached garage, if vehicles are allowed to idle in the garage, especially if the attached garage has a connecting door between the garage and the home. Attached garages can also be a source of volatile organic compounds, or VOCs, which are chemicals that are in the air at room temperature, which can arise from improperly stored fuel containers and fuel-powered equipment. Small engines such as lawnmowers, snowblowers, and trimmers do not use fuel injection systems, and so the fuel has the potential to evaporate from the engines into the garage and ultimately into your home. In the home, there are also non-combustion related sources of VOCs. Items such as inexpensive furniture and cabinets made from manufactured wood may be a source of VOCs, as well as carpeting and flooring. Cleaning products can also be a source of VOCs depending on their composition. The materials that your home is constructed from, especially in newer homes, can also be a source of VOCs. Now, building materials such as oriented strand board or chipboard, as well as I-joists, which are the support beams between the floors, can be made of manufactured wood and can be a source of VOCs, as well as the paints and stains used in your home. As well, some hobbies that use glues or solvents can also increase the amount of VOCs in your home. Now, indoor moisture, if not addressed, can lead to mold growth. Mold is found everywhere in the environment, much like bacteria, and if provided the proper conditions, can grow on surfaces within your home. Most people have probably experienced mold growing in their bathroom due to the fact that bathrooms can remain humid after showering, which provides the mold with a hospitable environment that allows it to grow. But mold can also grow in other places in your home, such as basements and crawl spaces if they're humid, and even in the main living area in your home if your moisture levels are too high. While this isn't a source itself, not having good ventilation in the home can allow pollutants and moisture to accumulate inside, so poor ventilation can lead to poor indoor air quality. It's important to make sure your home is well ventilated with fresh air to expel pollutants and moisture outside. Now, one of the primary pieces of advice we give to Canadians is to make sure you bring fresh air into your home to flush out pollutants and moisture. Depending on where you live and what is in your surrounding area, for example, if you live near a busy roadway or industry, levels of outdoor pollutants can be of concern, and so knowing when the outdoor air is good or bad is important for protecting indoor air. Depending on where you live, and if it's available in your local area, you can use the Government of Canada's Air Quality Health Index, also known as the AQHI, to determine the health risks of air pollutants found outdoors. The AQHI provides a number from 1 to 10 that indicates the potential for the air outside to affect your health. Now, as I mentioned, there's several important air pollutants to be aware of in your home. The pollutants of concern can be grouped into the following 3 categories: chemical, biological, and radiological pollutants. Chemical pollutants comprise the following list. Particulate matter, as I discussed, refers to tiny particles in the air which can be inhaled and which can deposit in the lungs. Particles are a complex mixture of solid material like carbon or minerals and chemicals that can be on the surface of these particles, or in some cases, the particle can consist of entirely soluble material which can dissolve into your lung tissue once they're deposited on the surface of your lungs. Carbon monoxide is a pollutant produced during the incomplete combustion of organic material, and which has the potential to cause health effects and, in the extreme, asphyxiation. Nitrogen dioxide can be produced by the combustion of natural gas, which can arise from your gas stove if, as I mentioned, the range hood fan is not operated during cooking. As well, nitrogen dioxide can be produced by gas-powered heating equipment if it's not properly vented outside. As I outlined, volatile organic compounds are chemicals which are in the gas phase at room temperature so they can be inhaled from the indoor air. There's hundreds of different VOCs that can be found in your home with different health effects. Formaldehyde is a pollutant that can be found in building materials and consumer products made with glues or other adhesives. It can also be found in some spray foam insulation products used in the home. Some of you may be familiar with a product called UFI, which stands for urea formaldehyde foam insulation, a product that has since been banned from use in Canadian homes due to the potential for formaldehyde exposure. And ozone, which is a molecule comprised of 3 oxygen molecules and which is very reactive in the lungs. Ozone can be produced by some air cleaning equipment, so people should avoid being in indoor spaces where ozone equipment is being operated. Now, out of the listed biological pollutants, mold is the one that most people are familiar with as an indoor air issue, as people can see mold growing in their bathroom and on their walls and can recognize a musty smell when mold is present. Other pollutants can include bacteria, house dust mites, and aeroallergens such as pollen and spores. Now, radon's in a class of its own, and it's studied by the Radiation Protection Bureau at Health Canada. Radon is a naturally occurring radioactive gas that can seep into some basements depending on the location of your home and the structural integrity of your basement. Radon is an important indoor air pollutant as it can cause lung cancer following prolonged exposure, but it's also a pollutant that can be monitored and remediated. In most cases, increased ventilation of the basement can reduce or remove the problem. So, now that you're aware that we spend a lot of time indoors, we have pollutants we need to be aware of, and we know where they come from, who's at risk. Well, indoor air is something that we should all be aware of in order to protect the health of ourselves and our families. As we all spend a considerable amount of time indoors, we all have the potential to be exposed to indoor pollutants. However, susceptible individuals are more likely to experience health effects. This includes people such as those with pre-existing heart and lung conditions, such as cardiovascular disease, asthma, or COPD. The elderly, due to the fact that as people age, their susceptibility to pollution increases. Children, due to their smaller developing lungs, as well as increased activity levels, along with those who are pregnant. and people who are active, both outdoors and indoors, especially in the case of patients with cardiovascular disease who exercise in the home. Now, exposure to air pollutants has been shown to be associated with health effects in the respiratory and cardiovascular systems. In the following 2 slides, I'll highlight 2 of the pollutants found indoors that can impact the cardiovascular system. Particulate matter, due to its physical nature, has inertia and can be carried into the lungs whenever we breathe and can deposit within the lungs. Larger particles will deposit in the upper airways, which can be removed by coughing and then either swallowing or spitting them out. Whereas smaller material can be carried deep into the lungs where it can deposit in the smaller airways and in the alveoli where gas exchange occurs. Particles that deposit in the lungs have the potential to cause direct effects to the lungs, either through chemical effects or mechanical damage due to the particle shape, or they can dissolve into the lining of the lungs and into the bloodstream and result in health effects further away from the deposition site. Now, outdoor particulate material has been shown in a large number of studies to be strongly associated with cardiovascular and respiratory mortality and morbidity endpoints. There's no recognized threshold of health effects for outdoor particulate matter, regardless of where the exposure occurs, either indoors or outdoors. And there's evidence that health effects occur at current levels of exposure. A much smaller numbers of studies have investigated the relationship between indoor particulate matter and health, with some evidence showing a relationship between indoor particulate levels and declines in lung function and increases in markers of airway inflammation in children with asthma. Associations between indoor particulate matter and subtle changes in markers of cardiovascular disease have also been observed in older adults. Another pollutant to consider for those with cardiovascular disease is carbon monoxide. Carbon monoxide is a tasteless, odorless, and colorless gas at room temperature, and it's usually formed during the incomplete combustion of organic materials. The acute risk of carbon monoxide exposure is asphyxiation, which is the reason we're all encouraged to have carbon monoxide alarms in our homes. But carbon monoxide has been shown to have effects in individuals with coronary disease when exposed to low levels of carbon monoxide. Exposure to carbon monoxide impacts the ability of the body to carry oxygen, that therefore those with compromised cardiovascular systems have been shown to be even more impacted than the general population and demonstrate health effects at quite low levels. So, pollutants found indoors have the potential to cause health effects, especially in people with cardiovascular disease. What can we do to protect and improve the air indoors? Well, the indoor air section at Health Canada produces information for homeowners to use to identify what pollutants you should use, what you should be aware of, where they come from, and how to protect your health. We do this by producing infographics, such as the example on to maintain and improve indoor air quality, which provides a summary of our recommendations for improving the quality of air in your home. We have several other infographics that provide summaries of good practices that you can adopt in your home, with topics such as ventilating your home and what steps you can take to protect your indoor air when the outdoor air is poor. As well, we have several infographics on specific pollutants, such as fine particulate material, along with other pollutants such as mold and carbon monoxide. These infographics are quite popular with people who appreciate the graphical representation of the science, and the printed copies are double-sided in French and English, so they're popular at events like home shows. We distribute hundreds of these every year. Now, these infographics are derived from larger, more technical documents. As part of the indoor air section at Health Canada, we've developed a series of residential indoor air quality guidelines on a range of indoor air pollutants. These guidelines are usually 4 to 6 pages long and provide a summary of a much larger science assessment document, which can be 50 to 100 pages long, and which outline the source of the pollutants, the health effects, and our recommended levels for the pollutant indoors. Health Canada has developed a prioritization process for determining which pollutants to study and develop guidance for, which involves us keeping abreast of the current research into indoor air pollution, along with input from our federal, provincial, and territorial partners. These guidelines are routinely reviewed and updated as new science is developed. Now, currently we're reorganizing our website at Health Canada to ensure that all of our products are easy to find and available for download, but I can make any of our products available to you electronically if you contact me after the presentation. So how do you protect and improve indoor air quality? I've broken our advice down into 3 different categories: source control, healthy behaviors, and maintenance and monitoring. The most effective way to reduce indoor air pollution is to remove or reduce the source of contamination. As I mentioned, combustion is a source of pollutants, especially particulate material, so removing or limiting sources is important. This means you should not smoke indoors. As well, other combustion sources such as burning candles or incense should be limited or avoided. Attached garages can also be a source of combustion products, along with pollutants associated with fuel storage, so vehicles should not be allowed to idle in your attached garage. If there's a door between your home and the attached garage, it should remain closed and have proper sealing around the door to prevent infiltration of air into the house. Storing your fuel in a shed or other buildings not attached to the home would be best. Properly storing paints and solvents with tight-fitting lids is important, as is making the effort to choose low-emitting products whenever possible. High humidity in your home can lead to mold growth, so it's important to ensure that you control it. Running your bathroom fan after you shower and running the range hood fan over your stove when you boil water is a good way to remove the excess moisture from your home. If needed, a humidifier or a dehumidifier may be warranted if your house remains too dry or too moist. Health Canada recommends that you maintain your humidity levels between 35 and 50%. Next, there are some healthy behaviors you can adopt to improve your air quality indoors. Ventilation is a very effective method for protecting your air indoors. If the source of your indoor air pollutants is inside, the best method to improve your air quality is to exchange the poor indoor air with fresh outdoor air. This can be accomplished by simply opening your windows, running your air conditioner, or using your furnace and ventilation system to ventilate your home. In Canada, many new homes are equipped with a piece of equipment called a heat recovery ventilator, or HRV, which is essentially a fan that allows you to ventilate your home all year long while using a heat exchanger to retain the heat in your home during the wintertime or help keep the heat outside in the summertime. All of these methods can be used to increase ventilation by bringing in outdoor air. Now, considering that ventilating our homes requires bringing in outdoor air, it's important to be aware of the condition of the outdoor air. As I mentioned, you can use the Health Canada's Air Quality Health Index to help you determine what the quality of the air is around you. Being aware of your local conditions can also be important. If applicable, ventilating your home when traffic levels are low or avoiding ventilating when your neighbors are using their wood-burning stove can help to reduce bringing in pollutants from outdoors. You may consider limiting your ventilation on days when the outdoor air quality is poor. Now, as I outlined earlier, particulate matter is of concern to people with cardiovascular disease, so filtering the air can improve the quality of your air and protect your health. If possible, a high-efficiency particulate air filter, or HEPA filter, can be used in your furnace to allow for filtration of all the air entering your home. HEPA filters trap extremely small particles, which helps to improve the quality of your air. Now, some furnaces cannot handle the pressure drop across a HEPA filter, so if your furnace does not support a HEPA filter, purchase the highest quality filter that you can. Portable air cleaners are also a good option for the home. It's advisable to choose cleaners equipped with HEPA filters and to operate them in rooms where you spend most of your time, for example, the living room and your bedroom. Ensure that you purchase a filtration unit that is appropriate size for the room that you plan to use it in. Now, while they're becoming much less common, do not use air cleaners that are designed to emit ozone. As I mentioned, ozone is a harmful air pollutant that some cleaning companies use to clean some indoor environments, but it's harmful to the lungs and it should not be inhaled. Now, vacuuming is a good way to control dust, but you have to be a bit mindful. Some inexpensive vacuums simply resuspend the fine dust into the air, only to have it resettle on surfaces again. Using a central vacuum that vents to the outside, or a vacuum cleaner with a HEPA filter to trap small particles is best. An alternative to vacuuming is wet mopping. As mentioned previously, using your range hood fan and bathroom fan are a good way to control moisture, but using these fans also contributes to increasing overall ventilation in your home. And the third thing to think about is maintenance and monitoring. It's important that you inspect and maintain all the combustion appliances in your home. This is to ensure that they are operating correctly and properly vented. You should ensure that you install at least one carbon monoxide detector in your home, but preferably one on every level, and install them close to your bedrooms. Newer carbon monoxide alarms provide a low-level display, which will provide you with a measure of level in your homes at levels below which will trigger the alarm. We recommend this type of alarm for those with cardiovascular disease because it allows for routine monitoring of the carbon monoxide in your home at levels below those which would cause a traditional alarm to sound. And as I mentioned, it's important to control moisture in your home, so installing a hygrometer in your home to measure humidity is a good idea. And finally, take action to measure and lower radon. The following Government of Canada website, takeactiononradon.ca, provides information on purchasing testing kits and taking steps to remediate any radon issues you have in your home. So armed with the knowledge of what pollutants we should be aware of and what steps you can take to protect yourselves, maintaining and improving your indoor air quality isn't terribly complicated. This slide outlines some of the highlights of our indoor air quality house fact sheet that I showed earlier. Controlling sources such as smoking, limiting exposure to VOCs, and being careful how you use your attached garage can limit the sources of pollutants in your home. Ventilating your home, filtering the air, and controlling moisture are practices you should incorporate into your household. And maintaining your appliances and monitoring for carbon monoxide, humidity, and radon is highly recommended. So to summarize my presentation today, we spent a lot of time indoors, and especially now that many of us are working from home due to COVID, we're spending an even greater amount of time in our homes. Our homes can be a source of indoor pollutants, but we're able to identify what they are and how to control them. This involves the 3 strategies I covered today, which involves controlling the pollutants at the source by removing them from the home or preventing them from coming in, adopting healthy behaviors such as ventilation and dust control, and making sure that your combustion equipment is operating properly and being continuously monitored. Now, as this presentation has been requested by the Heart and Stroke Foundation and is being watched by people dealing with cardiovascular disease, while not minimizing the other potential sources of pollutants indoors, a focus should be placed on controlling and removing fine particulate material from the indoor environment. I want to thank you for the opportunity to present today, and at the end of the presentation, I welcome any questions or comments. Thanks.
Thank you, Patrick. Those are some great practical tips that we can all do to incorporate into our home to improve our air quality. And we thank you for presenting today. So our next speaker today is Jennifer Harris, and Jennifer is the manager of Cardiovascular Disease Prevention and Rehab Outreach Programs at the University of Ottawa Heart Institute in Ottawa, Ontario. Over to you, Jennifer.
Thank you for the introduction, Pam, and it's a pleasure to be here today. As you can see, I have no disclosures. As Pam indicated, I work at the University of Ottawa Heart Institute as a physiotherapist in the Division of Cardiovascular Prevention and Rehabilitation. And I'm very happy to be part of this partnership between Heart and Stroke Foundation, Health Canada, the University of Ottawa Heart Institute, and the Canadian Association of Cardiovascular Prevention and Rehabilitation, or CACPR, which I also represent. We're now going to shift gears a little and talk about ways to stay active this winter. As you are likely aware, winter exercising can look quite different than summer exercise, so may take a little planning and sometimes an entirely different plan. Despite the lovely reprieve of summer weather many of us are now experiencing, our little taste of winter a few weeks back was a good reminder that it is not too early to think a little bit more seriously about getting our plan together for winter exercise. Top on the list for keeping our heart and brains healthy is trying to do daily aerobic exercise, or exercise that gets our heart pumping a little bit more than it does at rest. There are many forms of aerobic exercise that can be accomplished throughout the winter, both inside and outside. Let's talk about outside first, since it has the added benefit of sunshine with hope and fresh air. Things like cross-country skiing, skating, snowshoeing, and of course walking are all great choices. If walking this winter is something you think you'd like to do but haven't done before, some things to think about might be ensuring that you have good footwear designed for walking in the winter, and maybe even trying some attachable grips to the bottom of your footwear to help ensure that you won't slip. Another tactic to enjoy winter walking, as seen in the picture here, is thinking about trying walking poles. Invented in the Nordic countries, walking with poles is not only a wonderful form of exercise any time of the year, but in the winter, the poles can give you a little bit of added traction and stability. Clothing is also an important consideration for all kinds of outdoor exercise. Ensure that you have a variety of layers so that you can adjust accordingly, and that your base layer is breathable to avoid a damp layer next to your skin. Trying to get outside when you can safely is a great strategy to stay healthy this winter. But of course, there will be days that are too cold or too wet or too windy or too icy or just too unpleasant to get you outdoors. If accessing a gym or a mall for walking isn't feasible where you live because of COVID restrictions or bad weather, or you just don't have access to those kinds of things, you can turn to exercise in your home using some of the tips and strategies that Patrick mentioned to optimize your indoor air quality. As an example, if you have the space, exercise equipment can work well. Things like a stationary bike or a treadmill can be very versatile and can often be found for resale in classifieds. Another option for those who have internet access are the many great online videos to help keep you moving. You might think of an exercise video as requiring dance coordination. And of course, dance is a wonderful form of aerobic exercise itself, but there are many kinds of styles and levels of abilities of videos available. At the Heart Institute, we do have a link to several of these different video options if you're looking for a place to get started. And we'll post that in the chat to give you a place to start. But you can also check your local rehab program as well, as many are offering online exercise programming featuring their own experts. In addition to aerobic exercise, we also know that strengthening exercise is very beneficial for heart and brain health. Canadian guidelines encourage adults to include strength exercises in your routine at least twice a week. These kinds of exercises can easily be done indoors, and you can use simple equipment like weights or resistance tubing or even household objects. But there are also many ways to do strength exercises just using your own body weight. Things like step-ups on your stairs, standing lunges or squats, wall push-ups, or even standing up from a chair are all great examples of resistance exercises. This is another form of exercise that there are many videos for online. So again, feel free to start with the link we just posted to give you a place to start. While thinking about strength exercises, it's important to try and include some balance work in those types of exercises, and it's never too early to start working on your balance. It's also a very easy thing to incorporate into your routine. The key is really to find a situation where you can challenge your balance safely. So standing on a counter, in front or behind a chair, or even in the corner of a room with the two walls to support you. You want to work until the balance exercise you're doing is difficult for you, and that's the best way to help make sure you improve your balance. Now, while all these guideline information are important, aiming to do aerobic exercise every day, trying to incorporate strength and balance exercises a couple of times a week, the main message is that any and all exercise is great for you. It can be a little daunting to think about doing 30 minutes of exercise every day and trying to make sure we're doing these different kinds of exercise. But as long as you're doing something, you are doing your body good. So congratulate yourself for any amount of exercise that you do, and just gradually increase it if you perceive that you've got a way to go to meet the guidelines. Now, one of the hardest things about exercise is sticking with it. We know from the wealth of research that has been done that having a plan and tracking your progress make a big difference to how likely you are going to stick with it. Consider some of the things we've been chatting about today in terms of planning for winter. If the snow came tomorrow and you hadn't given any thought to making your outdoor walking safer or more comfortable, you might be less likely to do so. And conversely, if you've already gone out and purchased some new winter walking boots or some snowshoes as an example, chances are higher that you will use those things. And tracking your progress is another strategy to help you stick with your plan. There are many different ways to do this, including wearable watches, your smartphones, online platforms where you can have your devices synced to the platforms or even manually log in what you've done. And of course, good old-fashioned paper and pen to help you keep track of all your great accomplishments. Warming up and cooling down are also really important in terms of keeping our hearts and brains safe when we're exercising, especially when it comes to doing aerobic or that heart pumping exercise. So start your exercise session in a way that gradually increases how hard the work is, to give your heart and lungs and muscles time to prepare optimally for that harder part of the session. A warm-up can simply be a light version of what you plan to do. For example, starting your walk slowly and on flat ground. It's also important not to forget the warm-up when doing activity that you might not think of as exercise, like snow shoveling as an example. If you're heading out to shovel, consider warming up first, even taking a little walk, and at least starting with light loads and at a slow pace to get started. Better yet, keep that load light the whole time you're shoveling to be the most body friendly. Our bodies are very good at helping us know when we've done too much and even when we may not be doing enough. If we feel pain, especially a new pain for us, discomfort in our chest, undue shortness of breath, nausea, or a headache when we're exercising, these are signs to stop, take a break, and even check in with our healthcare provider, especially if those symptoms are not normal for us. On the other hand, if we feel as though our body is not putting forward any effort at all, perhaps it's worth trying to work a little bit harder. As a general rule of thumb, we want our exercise sessions to feel moderate, not easy, but also not too hard. The talk test is a great tool we can use to make sure the sessions are not too hard. Once we can no longer carry on a conversation while we're exercising, that's a sign that the exercise has gone beyond a moderate level. So you can slow it down or aim for flatter ground. For those who've been routinely exercising at a moderate level and feel comfortable with that, there may be a desire to take it up a notch, trying something new and even a little more vigorous, like skate skiing or speed skating, jogging, or even shinny hockey if your COVID restrictions permit. If this is something you're thinking about, check in with your healthcare professional to make sure it's safe for you to take your exercise beyond a moderate level. Now, in addition to all this great movement that we've been talking about, we also need to be mindful of sitting less. Studies are pointing to the negative effects of being sedentary. So let's try and make an effort to avoid long periods of sitting. You can set an alarm or plan cues for yourself, like when the shows change or a commercial comes on, or the chapter of your book ends, or when your meetings are over. Whatever situation it is that keeps you sitting for a long period of time, try to come up with a solution to break it up, even if it's just for 2 minutes to get that blood flowing again. And I'll invite you now to do so. Stand up and shake out those arms and legs if you haven't already felt compelled to do it. Finally, just a note on social support. One of the best motivators can be other people. And of course, connecting with others is also good for our mental health. Unfortunately, many in-person exercise groups are not happening at the moment, but we can consider some other ways to connect with each other while we exercise. As an example, a simple telephone chat while we're walking has become very popular. If you have a mobile phone and headphones to make this convenient, it can work really well to connect with a friend no matter where they live. Forming an email or a social media group among friends can also help make you accountable and maybe even give you new ideas for some exercise you hadn't thought of. There are also more and more online exercise groups, some of which are even offering coffee and chat time afterwards, so really giving you that time to connect. In terms of finding some of these programs, you can check your local municipality or local gyms to see what's offered. But remember that virtual exercise has no geographic boundaries, so you can ask your friends or relatives, what they're doing, even if they don't live near you. Maybe you can join together. It's important to make sure the exercise class you choose is a good fit for you. And most places will allow you to try one of their sessions for free, and there are many free classes as well. At the Heart Institute, we do have a partnership with many fitness providers across Ontario and some in the rest of Canada who are offering online classes. So that's another link you can check out, and we'll paste that as well in the chat window. So finally, just some take-home messages. First of all, make a plan for your exercise routine to continue through the winter. If you plan to exercise outdoors, think about safe footwear, appropriate clothing, and maybe even some new winter equipment like walking poles or snowshoes. If you plan to exercise indoors, check out the tips that Patrick referred to at the Health Canada website to optimize your air quality before you plan to exercise. And we'll again paste that link as well. And finally, move a little more and sit a little less. Thanks very much for the opportunity to share today.
Thank you, Jennifer. Those 10 tips on how to stay active from the Ottawa Heart Institute has a lot of great resources, and we thank you for sharing some of those resources today. And as Jennifer mentioned, some of those were posted in the chat for all attendees today, so feel free to go check them out. And we would now like to open the remainder of the webinar for a Q&A portion. So if you haven't already submitted your question, now is the time in the chat box. And without further ado, I'm going to pass over the Q&A portion to my heart and stroke colleague, Brianne McVeigh, to moderate some of these questions that have been coming through for our experts. Thanks.
Great, thank you, Pam. I'm just going to check that everyone can hear me okay. Perfect. Okay, there's been a few questions coming in. I'm going to start with one for Patrick. You mentioned this briefly, but we've had a few questions about plug-in air fresheners or diffusers and their impact on indoor air quality. So could you provide a little bit more information on that?
Well, in general, we don't recommend them for use in your home. The thing is you don't know what kind of products are in a Glade plug-in. Well, I don't want to use a brand name, but too late. What kind of products are available in a plug-in or in a diffuser. So I know some of them can lean towards the more natural products, but even at, depending on the concentration, some natural products aren't great for you to inhale from the air. So, I mean, as a scientist, we would want you all to sit on a stainless steel couch in a house with absolutely no dust in it and absolutely no products in the air in your home. But, of course, we all have to live our lives too. So if you're the kind of person that likes those kind of things, my suggestion would be to sort of minimize your use. But in general, no, they're not great for indoor air.
Okay, that's great. Thank you. I'm just looking at a few other questions. There's one here about indoor plants. So what role can indoor plants play in indoor air quality? And if you have any recommendations on types of plants.
It's funny, the idea of using plants to improve your indoor air quality has been around for a really long time. I think there was some study from NASA or something that was done quite a long time ago that people tend to go back and look at. But in general, the amount of plants that you would need in your house to make any impact on your indoor air quality, it would probably be offset by the amount of wet soil that you would have in your house that would be leading to increased moisture inside of your home. So I mean, plants are wonderful. I have them in my house too, so I love having plants indoors, but selecting plants for improving your indoor air quality isn't really a substitute for a lot of the things that I spoke about today. So
okay, great, thank you. I'm going to call on Jennifer now. You've had lots of great tips about how to stay active in the colder weather, and we're wondering if you have any tips about how to stay motivated.
Yeah, staying motivated is one of the trickiest things. And I think aside from connecting with others, which we really do know helps with the motivation, having a variety of things to do can help so that it's not just one thing, and perhaps even, especially in the winter, a variety of indoor and outdoor so that you can make your plans based on the weather. And I think the last thing I'd mention about motivation is just try your hardest to stick with it, because I think for those of you who are listening who are regular exercisers, one of the things that motivates you so much is just the benefits that you get from doing it. So it's hard to give that to anyone who hasn't experienced it. So I encourage you to keep at it so that you get that motivation for yourself as well.
Great, thank you very much. I'm going to have one more question for Jennifer, and then it looks like we have a few more for Patrick. Jennifer, you spoke about many different types of physical activity, but you didn't specifically mention stretching or yoga. Do they count? Do you recommend doing those as physical activity in these temperatures?
You know what, stretching and specifically yoga are great forms of exercise to include in your fitness routine. And we certainly encourage our patients to include those as part of their regular routine. Yoga has the added benefits of helping with relaxation and possibly even strength, depending on the kind you do. But just be mindful that stretching and yoga don't include that aerobic exercise. So do those alongside your walking or other kinds of aerobic exercise as well.
All right, great. Patrick, we have a few questions here about UV lights and indoor air quality. Do you have anything to add about those?
You know, we don't get a lot of questions about UV lights and indoor air pollution. The idea behind a UV light would either be to like to kill bacteria or to kill mold spores in the air, or possibly maybe to, you know, chemical reactions in the air. I mean, as far as UV lights go, we don't really use them very much. We don't discuss them much. I don't think there's a lot of science behind UV lights for indoor air quality, but yeah, I don't have a lot of information on that specifically, to be honest with you.
That's okay, no problem at all. Let me just see here. Is there any other? I think we've covered the major themes that are coming through. There's some quite specific questions that I can pass on to you later, and maybe we can address them specifically. The one that keeps coming through is asking about duct cleaning. So whether duct cleaning in homes or systems is needed, do you recommend it? How often? There's a few of those types of questions.
Yeah, in general, we don't recommend that people clean their ducts, only because it's an expense. It costs money to have your ducts cleaned. And a lot of times their ducts aren't terribly dirty. If you've had construction in your home, if you had drywall work done in your home, it's something that creates a lot of dust that might end up in your furnace or inside your ventilation system. Sure, that would be a great reason to clean your ducts. But in general, I mean, a furnace is made out of stainless steel. The air is moving through it pretty quickly. There's not a lot of food for mold to eat, so there's not a lot of reasons for things to build up in the inside of your ducts. So unless you really suspect you've got some sort of a problem and you can see it somehow, if you put a scope or something inside of your ventilation system and you can see that it's actually worth doing, in general, just as a preventative measure, we don't tend to recommend that people get their ducts cleaned. It doesn't tend to improve indoor air quality much at all.
Okay, well, thank you for that. We have a few questions here about fireplaces, both gas fireplaces in particular, I think.
Well, gas fireplaces are great, just as long as they're vented. I mean, a gas fireplace runs on natural gas. As I mentioned, natural gas can produce nitrogen dioxide as a pollutant. So when you combust it, that's what you get. Your gas stove in your kitchen, if you don't run your range hood fan, you're filling your house up with nitrogen dioxide. So it's a pollutant that certainly does have health effects. And so if you're using your stove in your kitchen, you should always make sure that you use your range hood fan above your stove. And my recommendation would be to run it as on high always, no matter what your setting is, whatever fan you got, just run it while you're using your stove. As far as a natural gas fireplace, in general, those things are vented, but if you got a furnace in your house, you have somebody come and inspect your furnace once a year. It's the kind of thing that you should just have inspected just to make sure that it's operating correctly and that it's being properly vented outside.
Great. We have a question here about carbon dioxide. Anything related to carbon dioxide that you pay particular attention to or would recommend being aware of?
Carbon dioxide, you know, we produce it when we breathe. I mean, so you can have carbon dioxide in your home. As far as the health effects of carbon dioxide in your house, I mean, Health Canada has recently done one of our, as I mentioned in my presentation, our residential indoor air quality guidelines. We're in the process of finalizing a guideline on carbon dioxide. So we'll have some right up-to-date science on that particular chemical. So if anybody has any questions, Either you can put it in the chat if people can see it, or my email is patrick.goegan@canada.ca, and anything that I've shown today, I can certainly share things with people. As I mentioned, our website's in the midst of being reorganized, so some of our documents aren't as easy to find, but I can certainly make things, anything publicly available, I can make it available to people who request it. So.
That's great. There's a question here about kitty litter. Lots of people have pets at home and want to know a little bit more about that with respect to air quality.
I mean, it's dusty, right? I mean, so the air, what it's hard to say because, I mean, I'm sure that there's different formulations of what kitty litter is made out of. I mean, in general, I mean, as a person who, I'm trying to tell people to be careful with their dust. I mean, it's the kind of thing that maybe you should just, when you're scooping your cat box, that you do the best not to stir up plumes of dust in the air. But yeah, just treat it like any other particulate.
Great. Okay, so I think I've captured the main themes that are coming in. There are a few questions about other types of fireplaces, so wood burning or, but I imagine your answer would be similar around good ventilation.
I mean, the thing with an open hearth fireplace that you burn wood in, I mean, I used to have a fireplace in my previous house, and when you're first starting your fireplace, a lot of times you end up with some of the smoke coming into your house until you kind of get a draw going up the chimney and have the air going outside. I mean, burning wood inside of your house, much like running your barbecue in your living room, like it's not great for a home because it produces particulate material. It can produce carbon monoxide. So, I mean, as long as you're operating your fireplace properly, I mean, in general, as long as you got a good draw going and the air is leaving your home, you know, they're safe to use, but you have to be mindful when you use something like that. It's a little bit riskier than, like, let's say, like a fireplace, like a gas fireplace that's already designed to burn clean fuel and already designed to vent outside as soon as you turn it on. Whereas it's hard to determine how someone's going to use a wood burning or an open fireplace in their house. So.
Okay. All right. Well, that's great. So I've posted some links in the chat for everyone to see from your presentation, and we'll also make the presentation available with the active links in it, as well as your email address. So I think that's all from my end at this point. Jennifer, sorry, that was a lot of questions for Patrick today.
That's great. I'm happy for that. I maybe just add that, you know, in addition to the comments that Patrick made about the wood burning fireplace, that will be an example of choosing to do your exercise not while the fire is burning or in a different location, so you're not increasing your ventilation of those particulates.
Great, and I just see this slide for the community. So Jennifer did mention the benefit of being social and having that social support as we look to exercise and to stay connected. And so I just wanted to draw attention to an offering that we have at Heart and Stroke, which is our online peer support communities. And they're for both people living with heart and stroke related conditions and those caring for them. So if you want to check out those Facebook groups, they're private groups and they provide a moderated, safe space for people to connect, and they can share their journey, they can provide support and motivation for others, and it's a really great place to connect with people in a similar situation. So those are there for you. The information is in the slides, and you can reach us at heartandstroke.ca/connect and register from there. I think at this point, I'm going to pass it back to Pam.
All right, well, that concludes our webinar for today. So thank you so much to our panelists, Jennifer and Patrick, for joining us. We really appreciate your time, and thank you to everyone who attended from across the country today. We hope you have some nuggets of information you can take back and incorporate into your daily living. So once again, the presentation will be posted on our YouTube channel, and we wish you all an excellent day. Thanks.
Thank you.
Thank you.